Call the meeting of the Board of Health of October 4th to order. The first item on the agenda under new business is acceptance of the minutes of the September 6th meeting. Do we have a motion to accept the minutes?
Motion to accept.
Second.
Thank you. Next item on the agenda is the monthly development services report submitted by Jimmy Lee. Good evening.
Good evening. Let's see. So I guess we'll start out with the A&R African Market because the owner's here now.
Okay.
After our last meeting, we had all agreed that the only thing to be found in his store were prepackaged foods. Any food that he is going to prepare for himself will be done in his own office with the use of like a toaster oven, microwave, something like that. And then his stove was to be disconnected, and then we would phase him into cooking and preparing based on how well he would do with the prepackaged food. I went in there September 6th, and he has brought all of that food back into his store. So this is all of the pre-made stuff that's stored in Tupperwares. He's making his own juice. He's storing all that frozen, bulk ingredients in his coolers downstairs. Kitchen's full of dirty dishes. So pretty much back to square one. At that point, I just took the pictures and left, and I told the owner that I would leave it up to the board, at which point I notified Lisa and Building Commissioner Fuller. The Building Commissioner, he has agreed to, at this point, if the board chooses to keep him closed for food, that he would just cut the power to the building. We've tried to get back in there with Lisa and Mr. Fuller, but we haven't had a chance to do so. The gates have been drawn down. We knock on the door, no answer. But we have been getting phone calls from his customers saying that he has been open kind of later in the afternoon to kind of avoid us being in there. So that's where we're at now with that situation. Moving on to some of the other failed items here. You'll see a lot of them are going to be the schools. And that is kind of what we usually see when schools begin to open. These are some of these issues we see it year after year, pretty much. I don't know what else to do but to cite them. Some of them are more serious than others. Some things may or may not be an actual violation, but it could potentially be a dangerous situation because which school was that?
No anti-choke certification.
Right.
In a school with hundreds of kids. Rodents. No hot water in the hand washing sink.
Yeah. I mean, the list goes on.
And it's a problem. And so I think, we'd like to help you with that. I mean, there isn't anything else you can do in terms, except, they're part of the city. And I think that we need to have another reach out to the school department. And, I mean, some of it is maintenance issues with regard to the city side, and some of it is school department
Right.
responsibility. And so I think we need, and the concern is the Board of Health violation. So maybe we need a meeting of yourself and the board and the two people, Mr. Underwood and someone from the Commissioner's office, to have a discussion about, we have a Board of Health code and the city properties need to adhere to the sanitary code. it's discouraging to see all of these schools on here. And I don't know, maybe we need we'll start with inviting them to the next meeting.
Sure.
If anyone thinks that might be helpful.
Yeah, I mean, it's not.
So is it safe to say that Mr. Underwood that the school department has a list of all these violations?
Yeah, we leave every report, at the scene. I wanted to wrap
You leave the report with whom?
with the kitchen staff that's there, and they're supposed to report it to whoever they need to. But there's a few ongoing ones. I just want to get everything before I send the whole thing out to Aramark and school department and DPW and everything like that.
So would you compile the previous and the current, whatever's violations there are on any of the schools, and send a copy to Mr. Underwood and to Aramac and to the city commissioner, and invite them from the board to the next meeting?
Sure.
And then at the next meeting, if you could let us know what outstanding violations are still pending, and they can tell us what their plan is. It seems like there's a number of rodent issues, and so maybe the person from Bain should be invited to the next meeting, or is it Banner, I mean? Sorry. Just so that if he has any suggestions. Sometimes the issue is, holes that need to be closed up with access to the outside, or we just need to help them see that this really isn't acceptable, that we hold the restaurants and everyone else in the city to the sanitary code, and then the majority of the violations on this evening's health code, sanitary code failures are in our own public schools. It's a little frustrating. And as you mentioned, it seems to be year after year with some attempt on our part to some preventive work and attempt from us to, all we do is cite them, and it just seems to be we're back at square one come September. And these are the end of August. This isn't 3 months or 6 months of school open, built up issues. These should have been cleaned and ready to go.
Yeah.
Am I wrong? Yeah.
You're completely right about it. I mean, that's our frustration with it every year.
Yeah.
I mean, it now takes 2 years to change a ceiling tile.
Yeah.
I don't know. Some of these, I forget the school. We didn't have it out here because it technically wasn't a violation on our part, but operationally, the staff, they have a big vat where they boil pasta. Now, these ones, usually there's a drain. They can just pour it out, and there's a floor drain. That floor drain is not working properly, so they're filling up 5-gallon buckets of boiling hot water, carrying it to the sink, pouring it in. That shouldn't be right. And then there's small stuff like paper towel dispensers. The only reason they don't have paper in it because whoever orders the paper didn't get the right size. And they'll order tons of it, and they'll never have paper in the dispenser.
Yeah. So when we say no anti-choke certification, that means that there's no one been identified
Right.
by the kitchen as being certified in.
Well, either that or they can't provide any proof that they have a certification because it needs to be posted, same like their Serve Safe and allergen awareness.
Yeah, and is that an Aramac responsibility, or? I don't know, who knows?
I'm not sure, but someone needs.
Yeah. I'm sure that, well,
So for the next meeting, bring them all in.
yeah, I think we need to have a discussion. Somehow we're missing, they're missing the point of a sanitary code, but I'll hold further comment till we see how that goes. I'm sorry for the interruption.
Okay.
Go ahead.
Yeah, so beyond kind of some of this failed stuff, I've talked to Lisa. You know, we've been getting these emails about people preparing food and selling it over Facebook. A lot of that's going on. This Sunday, they've come together with, you know, they try to make some kind of event at Shed Park with 3 different caterers, which we all looked up, and not a single one of them is licensed to do so. No one in the city is sponsoring this event or anything like that. So I'm really going to try to see if we can break kind of get these, you know, trying to round up these Facebook sellers, because there's a lot of them.
Really?
Yeah.
And so this Shed Park thing on Sunday, does it have a sponsoring agency or no?
It's just, it looks like 3 random caterers who just, you know, they'll post something on Facebook, I'm making X, Y, and Z today, anyone want to buy a tray, whatever, they can pick it up. And they've been doing this for a while.
Oh.
Some of these have garnered like a couple thousand followers, and now we've got 3 of them all coming together at Shed Park. So we'll have to go.
And are they selling food from there, or are they selling trays of food?
They're preparing stuff at their residential kitchen at their home and then selling it to anyone who would buy it online.
Nice. Okay.
Did we, during COVID, we talked about residential kitchens, right? And
Right,
approved
so-
that through the board so they could apply for a license through,
Yeah.
Okay.
So our department now permits cottage kitchens, what we call it. But cottage kitchens can only produce pretty much shelf-stable food, like candy, cake, cupcakes, stuff like that you don't need to refrigerate. These people are making like full-out dinners. So, yeah, that's always been a gray area for us. So I think this year it's going to be
Food that can spoil, that has no control over. Okay. So, Espresso Pizza is on our list as a regular,
espresso.
and it looks like they failed again July 31st. So they must be, are they on a schedule where there's more frequent inspection? Because it seems like they're regularly on the list.
Am I missing a page here? What date was that? Did you have those?
It says July 31st, Dawn failed, August 14th, maybe it was
Oh, you're looking at.
the list.
Oh, I see. Yeah. So that was from the last meeting. They were on the failed list for last meeting.
Oh, okay.
Yeah. Yeah.
Okay, so we're just getting this because you're just now able to print it out, is that it? or-
Right. So I've just keyed in I've lost the database during the attack, so we're just keying everything in manually.
Okay, so I may have remembered them from the last time.
Right. So
Okay,
it's going to be this list that.
right, okay.
So the last espressos, that was more like hardware stuff.
Oh, okay,
It's going to be Ansel, Hood, stuff like that. Prior to that, they had like a big rodent issue, which they cleaned up very well. So
okay,
it's not like the same things carrying over.
okay, good to know. Okay, do you guys have any questions? So, what is the recommendation with regard to the A&R African market? They're currently closed by us, or?
I mean, he was allowed to sell the
Right, and then that,
products, but he already. I don't know how many times we got to tell him he can't do it. So at this
Yeah.
point, I kind of leave it up to the board. Whatever decision you guys make, I'll let the commissioner know.
okay.
I did speak to the building commissioner, and he felt that if the board was okay closing him, the building commissioner is okay closing him as well, because there's been so many violations, and he's been out there multiple times, that the building commissioner is okay having him closed as well.
Okay. Are you all done? Okay, all right, thank you. We may, we reserve the right to recall you to clarify anything. Yes, sir, could you state your name, please?
Yes, Al Hassan Mansari. I just want to make it easy for everybody for this day. I'm just going to stop selling the food.
I'm sorry, could you just speak a little louder?
I say I'm going to make it easy for everybody that's involved about A&R African. I'm tired, so I'm going to stop to sell the food. I just need little time to take all my food, everything clean up, and so that we don't go through this any time. I'm going to do that.
Okay.
I don't want to sell the food no more so that he can be happy. The people, them all that involved wanted me there. I'm happy. Even me, I'm happy. Now that I can deal with the food, I can do something else and make more money better than the food. It's just that I love to cook. So I say, and the food that I cook, my African Jamaican people, they love my food because I'm a good cook. So, but with all what's going on, I just say, okay, I'm going to just forget about food. I just need time. I'll clear all the food out, take everything that's related to food. So
are you able to do that in the next week?
It's tough because I got freezer them. I need at least 3 to 4 weeks. I'll take everything out, some of the freezers then, because I need the space. I need people because I do all.
Well, I think 14 days would be reasonable. I don't know what the
It's tough.
the inspector thinks, but in those 14 days, you can't sell any food.
That's why I said I don't want to sell food no more.
So-
I just need now to take them out.
So I think, giving you 2 weeks to clear all the food out of there, take home whatever,
Not only the food, I have a lot of big freezers them that I have to take out, not because of the food, but I want to clear the space. I'm changing the whole thing to a different business.
well,
Where did you put all, because this happened before, right? So where did you move everything to before?
Well, that space is choked now. I can't do anything with where I put all the food. I throw some away, and the one that I have to keep, I keep. And because the packaged food, now we're talking about packaged food, like not the one I package, like food that I bought, and like canned food. So now I got to look for the space for those, and because I'm, try to.
okay, well, you don't have to have the empty freezer removed in the next 14 days, but you need to have all the food out of the,
Yeah, that's fine.
am I right, Jimmy? If the empty freezer is it takes you 3 or 4 weeks, that's okay. But you need to take all the food out of your market.
Yeah, I'm gonna do that.
So,
Little time than 14 days.
and then 14 days, and are you talking about you agreeing not to sell any packaged food also?
No food. That means
Nothing, right?
that people put in their mouth, including drinks.
Right.
Nothing, so that I don't have to deal with Mr. Jimmy, so that he'll be happy, then I'll be happy.
So just to be clear, it's not, the point of this is not to make Jimmy happy. He's enforcing a state sanitary code that you failed to follow.
Yes, I don't want to go back to that because
Okay.
I know you guys, you didn't get the whole picture, but it's no reason to, I willingly don't want to sell food. Plus his
Okay.
pleasure, so everything that goes on, I willingly not to sell food. So now, if I get 3 weeks, I can able to get
2 weeks for the food, 3 or 4 weeks for the empty freezer.
What's your name again?
Joanne.
Yeah, Joey. I decided not to sell the food, so I lost a lot of money on that food. If I ask for 1 more week to clear the thing, I don't think that's a problem. You said 2, I said 3. If I get 3, I'll be.
I'm not sure why you need 3 weeks to take the food that you shouldn't have had in the place in the first place out of the building.
I had all those food that we talk about, I have it out of the building. The one we talked about the last time when I was there, we talk about packaged food.
Okay, so you have 2 weeks to take the rest of the food that you haven't already taken out of the building, out of the market.
Okay, I'll go with that.
Okay, if you need another week to get the freezer out of there,
No, the
that's
freezer
fine
will
with,
stay empty. I'll take all the thing out. I'll take the food, I'll pack the freezer them in one corner.
I think that we need to have the freezers removed from the building as well, because it's too much of a temptation.
yeah, so I'm not sure why you wouldn't be taking the freezers out too.
That's why I asked for 1 more week.
Okay, so you have 2 weeks to take the food out and 3 weeks to get the freezers out.
2 weeks to take the food out, 3 weeks to get the freezers out.
Yeah.
I'll go with that.
Okay?
And I just want to preface that if there comes another call to the health department, what is going to happen at that point in time?
If they go there, they don't see no food, they don't see nothing.
So if we have a report of any further food, the market will be shut down for all sales.
For no retail and no food?
Now, somebody will call, people got nothing to do there. Maybe somebody that don't like me will call.
Okay.
And say they sell food. So if you go, you don't see no food, you don't see nothing, why should I get?
I'm saying if we verify that, if there's verification that there's food being sold in any shape or form after tonight,
Yeah.
then your ability to operate the market for any sales will end.
But now, because they catch me on that many, many times. Even the day he went, the last time he went.
Okay, so we're moving forward now. Is there anything else? Did you have any other questions?
No, I don't get no question. It's just this thing. Because if I take everything out related to food, I'm going to sell clothes and hair. I don't want to sell food.
Right.
For me.
Yep.
As I
You
go-
don't have any choice about selling food.
As I go through, I'll start packing my stuff to meet the 2 weeks.
Right.
To get all those food. You're not going to see one food
Right.
in my store anytime they go.
Okay.
I'll take all the food out. The kitchen will stay there. I'll use the kitchen for my hand, but there'll be no food at all. If they see food, you can close it. I don't know.
You know, no. I don't know what you're talking about. Kitchen. Go ahead, Mr. Lee.
Any establishment that does not sell food cannot have a commercial kitchen. If you're not gonna sell food, if you're not gonna sell food, you gotta decommission your kitchen. You gotta undo your kitchen.
I can't take roof off the.
You gotta get that stove out of there.
The stove is
As
not
long as
there.
that stove is there, there's no reason, how could I ever?
Come on,
trust that
Jimmy.
you're not gonna
There's
cook?
no stove there. I picked up the stove from the last, not even the last one.
It's from the building and everything, all these places that can't have food, or don't have a permit for food, everything has to get, all the gas lines gotta get.
There's no stove, and you can go there tomorrow. There's no stove. There's nothing to do with
No, he's not talking about the stove. What he's saying is the gas line. The gas line.
I call the,
Okay.
the gas company is shut off. The
Okay.
line is there, but there's no gas coming out.
Okay.
The gas line is shut off
Okay.
from the gas company.
Okay. So any cooking things need to be out of there as well as the freezers.
The freezer is going to get. I have no cooking stuff there right now.
Okay.
I'm not going to do food. I come here.
Okay, thank you. Thank you.
I'm not going to do nothing with food. I'm going to put the freezer in the corner, all empty. Take all the food out.
Yep.
There's not going to be one single thing you put in your mouth. If I want to eat, I'll go buy food.
We'll be out to check 14 days from today. Thank you.
So that I'm able to move on. Coming here every time, it's a little distraction for everybody for the same. So,
Thank you.
Yes. So,
Thank you.
okay. So 14 days from now is when?
18th?
October 18th.
October 18th, I'll put the freezer in the corner, take all the food out.
And then October 23rd, the freezer will be gone.
Yes.
Freezers, is there one or two?
It's a lot of freezers.
Multiple freezers.
Yeah,
It's a lot. I'll take them all out.
yeah.
I'll take everything out. It's going to be closed here.
And then you can bring in all the clothes and hats you want.
I'm so happy. Thank you.
Thank you.
While you're here, just on the 18th, you just wanna make an appointment, you can be there.
Yeah. No. Let's make an appointment.
On the 18th, make the appointment.
18th, 2:30.
I'll be here. Yeah.
Thank you.
You are welcome.
The next item on the agenda is the Community Health Needs Assessment information regarding tobacco use. Motion for what?
Motion, Ron.
To what?
2 weeks or 3 weeks.
Okay. So just for point of clarification, Inspector Lee, we're going to have a motion. Do we have a motion to give the A&R African Market and International Food 2 weeks to clean out all of their food items, including packaged food, out of the building and be inspected at 2:30 on October 18th? Do we have that motion?
Motion.
Second? All those in favor? Aye. Thank you. Anything else? Okay. The next item on the agenda is the information on youth smoking. So this is some information in follow-up to our last meeting. We had, I'm sorry? Oh. We had some sale of tobacco violations at the last meeting, and that was followed up by one of the violators speaking before the city council. And there was some interest in the city council on changing our tobacco regs. But in preparation for that discussion, we have received the information on the Mass Community Health Assessment and the Health Behaviors Tobacco, and you can see from the information that Lowell has the highest rate of smoking in both, let's see, Lowell's adult smoking rate is higher than the state average, the national average, and any other municipality in Greater Lowell. And we all know that according to the FDA, almost 90% of adult daily smokers started smoking by the age of 18, and about 1,500 youth under 18 smoke their first cigarette every day in the United States. I don't need to tell this board or Caesar or the Health and Human Services Director the importance of preventing the sale of tobacco to minors, but you can see that specific to Lowell, we have an issue in the city, and a massive 2022 Greater Lowell Health Needs Assessment done by the Greater Lowell Health Alliance found that lung and breathing issues were a major concern, and that specifically a priority was several people specified smoking or vaping as a priority health issue, particularly in relation to chronic illness and youth smoking. So just in follow-up to this informational packet, Director Golden, maybe what, with regard to Caesar, and maybe our community health educator, epidemiologists, public health nurses, whoever you deem appropriate, could take a look at what we're doing around youth smoking prevention and what else we might be able to do about preventing smoking in our youth. I don't know what's currently being done in the schools, what the health department could do with the youth and different programs, but in follow-up to the inquiry from the City Council and this newest data, maybe we could take a look at it.
Thank you, and I will report back to you, because I know that when my children were in the schools, the middle school used to have a program that Healthy Schools used to go in and do a full program, and they used to get them like in the 5th grade and start at that age to do a program in the schools, and I'll see if that's something that they still offer.
Okay. And I know that the American Lung Association of Middlesex County used to offer programs in the schools, and I don't know if they still do, but I think we should take whatever we can, get.
And especially since a lot of those things weren't going in during COVID, just to make sure now that COVID's done, that that's something that's going back
Right.
into the schools.
Yeah, okay, thank you. And the next item on the agenda is the Tobacco Control Monthly Report.
Yes, so I don't know if you want to call each one of these violators for the hearing, but before you do so, if you decide to do that, I just want to say a few things because I need to get this in the record. This apply to all of these, to the process that we do compliance checks in, and apply to all of these violators as well. Well, the first thing I want to say is that I'm not a member of this board. I'm sitting at this table here simply because of convenience. I'm not a member of this board. I am an agent of this board for the enforcement of tobacco regulations. None of the retailers requested an appeal, so we have 5 establishments before the board tonight. None of them requested an appeal. All retailers paid their fines. 2 of them were first offenders, so they paid $1,000 each. The remainder of these, the remaining 3, paid $2,000 each for the violations. I have received U.S. Postal Service confirmation that every single retailer has been notified of this hearing tonight. I'm saying this because we only have 2 people here representing a store so far. Compliance checks were conducted on May 16th of this year. The same minor, the same youth, participated in each of these compliance checks. There's a photograph of this youth in front of you. He's an 18-year-old male, and he was first recruited by the FDA inspectors, and then he was trained by me as well. This youth had nothing in his pocket except a cell phone and the money that I gave him. I observed him go in and come out of each store, and he came straight to the car. We checked 34 establishments that particular day, and the establishments before the board tonight were the only ones that actually sold tobacco to this youth. Each sold a pack of Marlboro cigarettes. So that means that 85.3% of all these 34 establishments did the right thing by asking to see an ID and not selling to this minor. The first 2 stores are first offenders, so they're subject to a 3-day suspension, 3 consecutive business day suspension of the tobacco permit. I want to stress it's a tobacco permit suspension, not a store permit suspension, so people will be able to have the doors open, just not be able to have tobacco there for sale. The remaining 3 establishments are second offenders. All 3 sold tobacco to a minor earlier this year, and they are subject to a 7-day suspension of that tobacco permit. Before you, there's a summary of each of these cases with a copy of the tobacco application that each of these tobacco store owners fill out, or managers fill out in order to get a permit. And I want to call your attention to item number 10, which says that the sale of tobacco to anyone under the age of 21 violates local regulation and state regulation. And item 11, that states that ID verification is required for every single sale. That's what I wanted to say. If it is more convenient for you, I can just start calling the establishments myself. So the first one is Lowell Package Store. To my knowledge, there's nobody here tonight representing that store. The sale occurred at 9:47 a.m. It was, this pack of cigarette was sold for $13. The minor was not asked for ID. So it's pretty straightforward. This particular store had no prior sale of tobacco to minor, but there's several other violations for which, we did not cite them. We just educated them about those violations, mostly signage violation. So my recommendation is a 3 consecutive business day suspension to begin on October 23rd. It's a Monday.
Okay, thank you. Do we have a motion to suspend the tobacco sale at Lowell Package Store, 305 Westford Street, for 3 consecutive days, beginning 10/23?
Excuse me, is that at the start of business? Excuse me. Is that at the start of business?
Yeah, let's start a business. So the certified letter will just make that clear, but the suspension is going to do it from the start of that business until the close of that business in that particular, at the end of those particular 3 days. I just want to say right now when that's going to end, because it depends on how often they're open. They have to be consecutive.
From the start of business. And then we have a second.
Who's the first?
Allison.
All right, so next is Sneak Pitch Video.
We had a vote.
Sneak Pitch Video. I don't think there's anybody here representing that store.
Okay,
Is there?
you said just 1 second.
So I just need to vote, so.
Go ahead.
Oh, I thought I
Yes.
had a vote already.
Erin?
Yes.
Allison?
Thank you. Next is Sneak Pitch Video. It's located at 301 Westford Street in Lowell. It's their first sale within the last 36 months. There's a sale that occurred on April 21st of 2016. That was an FDA compliance check. And there was a sale that occurred on June 3rd of 2014. There was a compliance check that we conducted. So this board asked to see the previous violations record, so this is a history of that particular store. But this is the first offense for the last 36 months pursuant to the state law. And
I'm sorry, was the FDA violation 421 of this year?
it was 421 of 2016.
Oh, okay.
It's right on your summary there as well.
Yeah, I don't seem to have that.
It's on the thing.
I gave you one.
Do you not get one?
I didn't
I
get,
handed you when you were here. Sorry.
oh, when I came in?
Yeah.
Oh, okay. Sorry.
That's all right. So, in this particular store, the minor was not asked for ID either. He was not challenged at all. The person who made the sale was actually the owner of that establishment. He's not here tonight. My recommendation is a 3 consecutive business day suspension beginning on October 23rd as well.
I'd make that motion.
Do we have a second? Second? All those in favor?
All right, and then vote, Joanne?
Yes.
Erin? Yes. Allison? Yes.
Next is L&S Liquors, address is 269 Branch Street. This begins the batch of those that actually sold earlier this year. This is a second offense. This pack of Marlboro cigarette was purchased for $12.75 at 10:28 a.m. on the morning of that May 16, 2023. The minor was not asked for ID, he was not challenged at all. The person who made the sale was actually the owner of that store. At least that's the person that appears as the owner on the application, the tobacco application. So the minor was not challenged at all. This particular store sold tobacco to a minor on March 2nd of 2022. I said earlier this year, but this one was actually last year. I make the correction. And so this is a second offense. My recommendation is 7 consecutive business days, tobacco permit suspension beginning on October 23rd.
So, thank you. Just for clarification, the second offense has to occur within 2 years?
Within 36 months.
36 months, okay. Okay, and there's no one here to speak?
There's nobody here representing L&S Liquor. Are you from L&S? Yeah, there's somebody here from L&S.
Okay.
Sir, can you just go to...
Did you have anything you wanted to say, or no? No? Okay. Okay,
Doesn't have anything to say.
okay.
I'll make the motion. Or-
We have a motion by Aaron to suspect tobacco suspension for 3 consecutive days effective 10/23 from the open of business on 10/23 to 10/25. And we had a second from Allison and a vote. All those in favor? Aye. Yes?
All right. Next, we have Country Farms, 268 Branch Street. It's a second offense as well. The first offense happened earlier this year on January 12th of this year. It's not the only sale at that particular location. There's been an FDA sale on April 4, 2019, and another sale through a compliance check by the FDA that occurred on June 8th of 2015. The minor was not, well, the minor in this particular case was asked for ID, still make the sale. I don't know what reason. A person identified as Mahesh Patel made the sale. My recommendation is, that person's not here tonight, there's nobody representing the store here tonight. My recommendation is a 7 consecutive business day suspension to begin on October 23rd, Monday.
The last one was 7 days, not 3 days.
Correct. Oh.
L&S was 7 days. Do we have a motion to suspend the tobacco sale at Country Farms for 7 days, also 10/23,
Yes.
effective 10/23, at the open of business on 10/23 for 7 consecutive days?
Motion.
Motion made, seconded. All those in favor? Aye. Vote?
Joanne?
Yes.
Erin? Allison?
All right. Next establishment is Harry's Food Mart Mobile. We have somebody representing that store here tonight. Mr. Nelson, would you like to address the board? But before you do so, let me just present what occurred. So this is a pack of Marlboro cigarette that was purchased at location on May 16 of this year at 10:48 a.m. It cost $12.54. The minor was not asked for ID. This is a second violation that happens this year. The first one happened on March 2nd, of this 2 years. The first sale happened on March 2nd of 2022. And there's no other sale to minors on the record of this particular establishment. But so there's been 2 violations. The minor went in, was not asked for ID. The person who made the sale is an employee who's always there. Her name is Alka Patel. She identifies herself as Alka Patel. So my recommendation in this case is also a 7 consecutive business days tobacco permit suspension to begin on October 23rd at start of business. So Nelson is here to address the board. You want to go to the microphone?
Good evening. My name is Nelson. I'm the store manager for Harry's Mobile, Ferrer, Ferrer. I'm basically here just to apologize that, you know, honestly, we made an honest mistake. There's no excuses. I can't sit here and say, oh, you know, they made a mistake. There's no excuses. We're dealing with minors here. You know, the person that got the fine, she was well-trained, is the wife of the owner. And she knows her job. It should have never happened. Even Caesar said, I think told her that he couldn't believe that she did it, you know. So I just wanted to come and represent Harvey's Mobile and apologize for the inconvenience. We run a tight business, you know, on all the stores here in Lowell, and all the employees are trained. The last offense that we had, it was a new employee, and I consider that my fault for him not being prepared to the standards, you know. But yeah, no, I just came to apologize, and you know, and hopefully we're okay with the 7-day suspension. I mean, I'm not gonna sit here and say it's never gonna happen again, because we don't know. You know, anybody can make a mistake, but a mental mistake is not acceptable. We were just requesting to see if we can get a 3-day suspension versus the 7 days, due to that tobacco and gasoline is our main moneymaker at the store. But I just wanted to bring that to the board if possible. If not, I'm okay with that too.
We appreciate you coming in. Thank you. Your recommendation?
My recommendation is 7 consecutive business days tobacco permit suspension beginning on October 23rd at the start of business.
We have that motion,
I'll make that motion.
and seconded by Allison. All those in favor? Vote?
Joanne?
Yes.
Erin? Yes. Allison?
I do have one question for you, Caesar. Were you able to recruit new youth to work as tobacco buyers?
Not yet.
Not yet.
Working on it.
Okay.
It's always every year, there's a little difficulty in the beginning of the year, but then we get the kids and then we conduct the compliance checks. So our sign-our amendment compliance checks had to begin October 1st anyway, so, you know, we're still within more than plenty of time to do the compliance checks, but we still don't have the kids.
Okay.
We had kids, 2 kids actually, this is one of them, but he's just not available. I was going to school and taking some projects associated with school, can't do the compliance checks, and the other minor took a job. She can't do it.
Okay.
I just want to say one thing regarding the stats that you read about that study. One thing that we are doing right now is actually passing regulations that restrict access to tobacco products. And that's one way that historically has been shown to have an impact upon the prevalence of smoking, and especially you know, by young folks, is to make tobacco less accessible by increasing the price of the product, you know, through taxing, you know, through the legislature, and by creating rules that, you know, impose, like, for example, in the case of cigars in the city of Lowell, you can't sell one single cigar for less than $2.65, and you can't sell a pack of cigars for less than $5.31. It's just to make it more difficult for kids to just have, just a pocket change and then buy tobacco products. Making the penalties stricter also assist in making the product less accessible. That's one thing we are doing. I'm sure we can do more. Yeah, and I think one area that we're probably going to find it's lacking is cessation, support for cessation.
I'm sorry, I didn't hear that.
Support for cessation. I think that's one area that we might find that it might be lacking in the city. There's an organization like 1-800-TRY to Stop or a similar acronym, and that offers assistance to people who want to quit. But I think that at some point we probably want to look at the benefits that cessation could provide at the local level.
Okay. Thank you.
Thank you very much for your time.
Thank you.
Collect the photo before I forget.
Thank you.
Well, sir, thank you very much.
Thank you. Thank you. The next item on the agenda is the Cashin and Associates Air Quality Report at Lowell High School. Any questions? It's had seemed to be one area that just, of all the areas tested, the first floor College and Career Center, and I'm not familiar with what size room that is or what kind of what ventilation is in there. The dust level was higher than the recommended amount, and there were some, not at the 500 level, but some TVOCs at 338. So could, Madam Director, could we just,
Oh, yeah, I see that now, the 285?
yeah, could we just
Okay.
inquire from Mr. Underwood if there's any improvement they could make in that room, or see what the, maybe, I don't know what the dust in what the situation is, but that particular room seems to be a little bit of an issue.
And I think this came out on the 15th of September, so there should be another one done
Yeah.
next week as well.
So maybe we can see
Okay.
what that room looks like on the next one, and
Yep.
see if they can do anything to improve the ventilation in there. I'm sorry? The next item on the agenda is the exemptions for childhood vaccinations. And so what we did was just get a copy of the proposed legislation, the legislation proposed by Senator Kennedy to remove the religious belief exemption. So I guess, are there any questions?
Was this an ask from them to ask, was that, I thought we had talked about that they'd asked for a letter of support or...
So, yeah, well, I made the offer to bring it to the board for discussion and a decision whether the board thought that we should offer a letter of support for the legislation. But if the board doesn't see fit to offer the letter of support for the legislation, that's up to the board.
Yeah. So I looked at it, and I think, so Rep. Vargas had put this in 2019, and it never made it, the Congress rejected it at the floor. My thoughts aren't on it, that it is, there's language that's written into the bill that says that during an emergency or outbreak, like that there are times that religious exemption can be not honored. And that language that's in there is pretty strong. It held for Executive Order 595. That was, Governor Baker made it that all executive branch employees had to get the COVID vaccine, and they held that. That was the same language that was used on appeal, and it was strong. So I think taking it out completely, they're never going to look at this bill. So I would like to see them maybe strengthen the wording that's in there, and I feel like we'd see more kids that, like, we all agree, vaccination in schools for all children in congregate settings improves safety for everyone. I just think that if it's all or nothing, it's never going to get looked at. That bill's going to sit it's just going to sit in a drawer. So I would just like to see them beef up some of the language versus having it be all or nothing. 'Cause then
Versus eliminating the religious exemption totally. Okay. Okay, so it's informational. We don't need to do a specific letter of support. I can give feedback to the senator's staff around that. Did you have anything you wanted to say, Lisa?
No, he just called to, his staff called today to say that the bill hasn't moved anywhere. Sorry, they're talking out there. The bill hasn't moved anywhere. He said it hasn't gone anywhere, so he just wanted to give us an update.
Okay.
That's all.
Okay. Alice?
And like I said the last meeting, this group of kindergartners, there has not been one religious exemption that was asked for. So it's not like Lowell has seen a huge influx in religious exemptions being asked. So our population's not asking for a large religious exemption. And I think it was, when we looked at our records, it was right around 3%, and that's where we've been sitting. So we're not in an area that there's a large group of people asking or abusing the religious exemptions.
I noticed that the bill says that folks that apply for physical exemption, that their certification or whatever should be reviewed by the health department physician. Does the school nurse staff do that, or?
So they're looked at by each, they're looked at when they're reviewed from the Family Resource Center, and they're looked at by the managers from the school nurses, but we don't necessarily bring them to Dr. Conley, but we would review them and then see, like, you mean if it's a medical exemption?
Right.
We'll look at them to see if there's a reason for the medical exemption, but generally the physician's office do question the parents if they're asking for a medical exemption, and they don't give a medical exemption unless there's a reason. And then say if a child's going through chemotherapy treatment, usually they get caught up with their vaccines after they're done with their treatment. So it doesn't prolong through the life of the child.
Okay, great
Yep.
to know. Okay, thank you. The next item on the agenda is just that, in the packet, there's a reminder that our next meeting will be held November 1st, not here in the mayor's reception room, but in the DPD Hammer Conference Room. Is there anyone from LTC that we need to notify regarding that, or
No,
is that a room that will not be televised?
the room will not be televised, so we will, that one will not be televised, right?
Okay. And then the next item on the agenda is the director's report.
So we do have the two reports here, the substance abuse report and the public health report, nurses report, if anybody has any questions on those.
did they hire the second syringe?
Okay, so I'll go through my list for you here. Okay, you ready? So we do have one public health nurse starting on Tuesday, and we have put an offer out to a second public health nurse. So we're looking better at that. We do have now one school health nurse vacancy, and we will have a second school health nurse vacancy. Beth did want me to mention that we do have some sub-nurse openings if anybody wants one. We did just take down the assistant syringe coordinator. So we do have resumes for that, so we will be interviewing. I believe we have 12 resumes that we got, so we have to go through those, and we will start the interview process for that. We have a posted social work position. We are interviewing for the substance abuse coordinator position, which we have a fair number of resumes for that. So I think we're going to interview 5 people for that. We're very busy. I think that's it, but that's a lot. We did hire a deputy director of finance for the Health and Human Services position. He started last week. I think that rounds all of that up. And then the new COVID shot came out. There's a little bit of a, getting the supply out has been a little bit rough because it was initially just Pfizer that came out. Moderna has been slow to get out, so what I've heard is that people are getting to Walgreens or CVS and the vaccine has not been available to them, so we do not have vaccine available at the health department right just yet because we haven't been able to order it, so we don't have vaccine available to give to the public right just yet. So anybody out there, just be patient with CVS and Walgreens because they really do not, they've been running out of vaccine because a lot of people want it. We do have, I believe as of yesterday, have our flu vaccine in. So we will be starting flu clinics for the public on the Tuesday, the 24th, and we will be doing Tuesday flu vaccine clinics from 4 to 7 at 107 Merrimack Street. We will start employee and retiree vaccine clinics starting next Wednesday, the 11th. The first one will be here in the mayor's reception room from 9 to 11, and then we will do one the 26th in the library from 2 to 5 p.m. And the one in the library may be open to the public as well. So, but we will put that out on social media.
Everybody get their flu shot.
Everybody get their flu shot. Yes, and once we have rollout of COVID shots, we will offer COVID shots as well.
We don't know yet when we'll get the COVID vaccine.
No, because we have not been able to order any, so. But as soon as we're able to, we will.
Is DPH supplying the COVID vaccine or no?
No, because we have to purchase it.
Oh. So they're not, DPH is not supplying directly to the health departments any?
They'll supply for uninsured, but we'll have to purchase, same as the flu. So they'll give it to us for uninsured. We have to purchase it for insured people.
I didn't have any problem at CVS.
I think you got there early because right after you, people had their appointments canceled. So
Okay, great. Anything else?
I think that's it. Unless you have anything for me.
Anything else? No? Do we have a motion to adjourn?
Motion to adjourn.
Second. Seconded. Thank you.